Welcome to the Spirit and Muscle broadcast. I'm Young Gerald, certified personal trainer. Is hormone replacement therapy the key to anti-aging, or is it the cause of increased risk of heart disease, cancer, and stroke? In this video, I answer that question as objectively as I can. I'll present the pros and the cons, and I'll share my personal experience using TRT, the good and the bad. I hold nothing back, so stay tuned. Welcome back to the Spirit and Muscle broadcast. I'm Young Gerald, certified personal trainer. First of all, I am not a doctor. This is not medical advice. I'm speaking as a patient, a fitness trainer, as a brother in Christ, and mostly as a friend. As always, I encourage you to do your own research. Hormone replacement therapy is the replacement of sex hormones in men and women to control symptoms caused by low levels of these hormones. For women, we're talking about estrogen and possibly progesterone and testosterone in small amounts. For men, we're talking about testosterone, which some of it converts into estrogen in the body, so there's no point in taking it exogenously. Low hormone levels are caused by aging and menopause, as well as certain health conditions such as Turner syndrome, kidney disease, and low-functioning pituitary gland due to injury or defect. The most common cause in both men and women is, of course, aging. Low hormone levels are diagnosed by taking a blood test as well as assessing symptoms. In cases where pituitary gland issues are suspected, a brain scan is also needed. Symptoms for low hormone levels include depression, fatigue, mood swings, trouble concentrating, and low libido and other sexual issues. More serious late onset symptoms can include osteoporosis, which is weakening of the bones, and cardiovascular disease. Women may also experience hot flashes and irregular or absent periods, and men may also experience a loss of muscle mass and increased body fat. These symptoms are an overview. They're not meant to be an exhaustive list. One reason testosterone replacement therapy is so controversial is that testosterone is an anabolic steroid. And when misused, along with other anabolic steroids, it can cause health problems. So legitimate doctor-prescribed TRT gets confused with anabolic steroid abuse. And another reason TRT is controversial is that the, quote, normal range is so broad, from 300 nanograms per deciliter to over 1,000. A man in his 20s might be closer to the higher end of the spectrum, and a man in his 40s, 50s, 60s may be substantially lower. But it's important to look at symptoms as well as blood testosterone levels. Here's the issue. Most doctors will not prescribe TRT for men that fall in that range regardless of symptoms, saying that it's just a part of aging and TRT causes health problems like steroids. HRT for women is controversial for different reasons. As far back as the 1960s, HRT was commonly prescribed to mitigate symptoms of menopause. In the late 1990s, two of the largest studies of HRT users were undertaken, one in the United States and one in the UK. Both studies released results in early 2000s, raising safety concerns of increased risk of breast cancer and heart disease. The media ran with it and caused a panic among doctors and users, and HRT prescriptions dropped 66% overnight. Since that time, the methods and results of these studies have come under much scrutiny. One thing that came out later was women used in the American study were in their mid-60s, and many of them were overweight. This does not accurately represent the majority of HRT candidates, namely menopausal women 45 to 55 years old. And a subsequent publication of the full results showed the apparent risk of breast cancer was only found in those who had taken HRT before entering the study. More recent results, published in 2020, showed a significant reduction in breast cancer diagnosis and mortality in women using estrogen only. Women using estrogen and progesterone did have an increase in breast cancer diagnosis, but not in mortality. Other studies report that obesity was a factor in cancer diagnosis, and that micronized progesterone is associated with lower risk of breast cancer than other forms. And regarding cardiovascular risk, recent data from Denmark has demonstrated that healthy women taking HRT for 10 years immediately after menopause had a reduced risk of heart disease. This study and follow-up data from the original American study both found that women who start HRT 10 years or more after menopause do not have an increased risk of cardiovascular events or mortality. So, in spite of that, today there remains widespread confusion and controversy regarding HRT and TRT, and many doctors will not prescribe it. Thankfully, there are doctors and clinics that specialize in hormone replacement therapy. Unfortunately, most insurance still will not cover it. Now, I've touched on some of the pros and cons, but I think it would be helpful to summarize them for you. The pros: HRT and TRT can help fight depression, fatigue, mood swings, improve concentration. It can also improve sexual function, increase lean body mass and bone density, and relieve hot flashes in women. Again, this is not meant to be an exhaustive list, but HRT and TRT can restore your hormone levels to where they were when you were much younger. And the cons? TRT in men can increase hematocrit, or red blood cell count. The fear is that the blood becomes thick and increases the risk of stroke. However, to date, there have not been any cases of stroke or severe clotting related to TRT. And this side effect has an easy fix. Donate blood a few times a year. There's also a fear of developing prostate cancer from TRT. And the reason is this: prostate cancer that has metastasized improves when treated by lowering testosterone. So the thinking is, if lowering testosterone improves prostate cancer, then raising it must make prostate cancer grow. However, if you look at the rate of prostate cancer in men taking TRT compared to men not taking TRT, the result is the same for both. So even though this is a widely held belief, there is no evidence to support it. A small number of men may experience other TRT side effects, such as increased acne, water retention, disturbed breathing at night, and gynecomastia or breast enlargement. And the cons for HRT for women: there may be an increased risk in breast cancer. Other side effects include water retention, breast tenderness, leg cramps, and headaches. These side effects do not happen to everybody and often pass within a few weeks. As for my personal experience, in January of 2019, I was diagnosed with low testosterone after filling out an online symptom questionnaire and having my blood tested. My testosterone level was a little over 300. I don't remember the exact number. So I was in the, quote, normal range, but my doctor was willing to prescribe me TRT based on my symptoms as well as the blood test. It's not that things were so terrible, I just wanted to feel better and younger. So I started taking it, and immediately I started feeling better and younger and stronger. Unfortunately, my gynecomastia that I had as a teenager started flaring up. For those of you who don't know, gynecomastia is when a male starts growing female breast tissue due to too much estrogen. What happens is extra testosterone in the body is converted to estrogen. And apparently I am extremely sensitive to estrogen. So the doctor prescribed me an estrogen blocker, and that seemed to take care of the symptoms. But unfortunately, the damage was done, and to make a long story short, last November, I got the gynecomastia removal surgery. Anyway, that clinic cost around $200 a month, and the doctor wasn't all that attentive. I had heard of another hormone replacement clinic called Defy Medical, and they had great reviews and were less expensive, so I switched over to them, and all I can say is they are awesome. I can't say enough good things about them. My PA is named Janelle, and she's the best. Janelle, if you see this video, thank you so much. It was only after talking to her that I realized how cookie cutter the other clinic was. Janelle has worked closely with me to fine-tune my regimen, and we realized the other clinic was over-prescribing my testosterone and estrogen blockers, and apparently my testosterone was through the roof and my estrogen was crashed, giving me sore joints and some other symptoms. And I didn't know it. I didn't realize this until Janelle started asking me questions, and we kind of got to the root of it, and she adjusted my dosage, and I've been great ever since. So that's about it. Let me know if you have any questions. If you leave them in the comment section below, I'll be sure to answer them. And also I'll leave a link to Defy Medical in the description in case you want to learn more about hormone replacement therapy. They serve men and women. And if you do decide to become a patient, I have a special coupon code good for 10% off your initial labs. And I'll put that in the description as well. Okay, that's it for this week's Spirit and Muscle broadcast. Thank you for joining me. If you're getting value out of these videos, please like them and share them. Again, my goal is to help as many people as I can. Subscribe for more helpful content like this, and like our Facebook page, follow me on Instagram. All the links are in the description. That's all for now. God bless you, and I'll see you in the next video.